Roll up, ladies and gentlemen. Roll up for Innovation Panel 2. So welcome, everybody. We're a little bit late starting, I'm afraid. My name's Pete Carpenter. I'm the Director of Programmes at Health Innovation West of England, and I'm going to be Michael Parkinson for the next 45 minutes or so. I'm just going to turn to the panel to introduce themselves. Chen.
Thank you. I'm Dr. Chen Mao Davies. I'm the founder and CEO of Anya. Anya is a multi-award-winning health tech startup. We use cutting-edge AI technology and leading healthcare experts to provide 24/7 healthcare and companionship during women's health journeys. And this includes fertility, pregnancy, parenting, menopause, and menstrual health.
I'm Genevieve. I'm a Senior Programme Manager at the Health Innovation West of England, leading the Evaluation and Insights portfolio work. My background's in clinical research and evaluation across NHS services and public health, and more latterly in the innovation sector working for Health Innovation Networks.
So hello, I'm Peter. I'm the Head of Digital Transformation for the Gloucestershire ICS. What that means in practice is that I lead a number of sort of portfolios of work around things like patient-facing technology, digital healthcare, digital inclusion, and I also have a bit of a research and a bit of an operational background to fall upon occasionally.
Thank you, Peter, and thank you. Welcome, everybody. So this discussion follows on nicely from the conversation in the previous panel. The end of that discussion talked about how we can avoid repeated pilots and spread and scale effectively across clinical teams, trusts and organisations. So we're going to be talking about what it takes from an innovator perspective in terms of developing your product or solution, and Chen's going to talk about a little bit about her journey through that, and then from a system perspective, picking up a lot of what Hassan was, I think, challenging us about earlier, is what does it mean from a system perspective and from commissioning, procurement, etc., to think about how we can fast track and encourage the development of innovation and spread and scale. And that's then going to lead on to a little bit more of a detailed discussion on that topic in the third panel. So Jen, I'm going to start with you if it's okay. One of the terms that we throw around a lot and talk about a lot in the health innovation networks is real-world evaluation. And I just wondered if you'd kick us off by talking a little bit about what that might mean, both from an innovator and a commissioner perspective and from a system perspective, and think about, and then we'll get into the discussion from there. So Jen.
Yeah, I think it's a question that often comes up, isn't it? What's different about real-world evaluation? And I think probably 5 or 10 years ago, you often didn't hear people talking about real-world evaluation. But as we've understood that we need to be able to understand different pathways, interventions and programs a little bit differently in real-world settings, the concept of real-world evaluation has evolved in terms of the way in which we evaluate those types of projects. So fundamentally, we're still using really robust processes to measure things, but actually what we're doing is we're recognising the context might be different. So we tend to be working with interventions or innovations that are already deployed in a setting. There's a clinical evidence base for them. So quite often commissioners know they want to use that particular intervention or innovation. So what we do is we come alongside that and we think about how can we help you generate real world evidence for it. And I think one of the big differences is that when we're working in research settings, we tend to try and control for all the external and contextual factors around it. But in real world evaluation, actually we work to collect data in the real world setting. And that in reality sometimes means it's not perfect, but we can still draw robust insights from that. So it's working in real world settings and collecting real world data. And that's very different from how we control in research settings. So I don't know if that answers that enough for you.
Yeah, thank you, Jen. We might come back to that, I think, a little bit in terms of the different perspectives of information that's helpful for innovators to help develop your product or solution. And Chen, you've been pretty successful nationally, starting off in 21-22, working across 4 ICBs and then developing Anya from there, which now has a reach across a potential population of up 7 million people across England. And I just wondered if you'd share a little bit about your journey from and how that happened, and then particularly pick up themes about barriers and how you overcame those. So it'd be great to hear a bit about that.
No problem. Thank you. So I'll focus on the first bit first, and I'll give you more details later about my journey further on. So to start with, I used to be a computer scientist. I was not a healthcare professional. I don't have any experience about digital health. So my experience in the past was creating visual effects for blockbuster movies, and won Oscar and BAFTA awards as well for best visual effects. So worked on many movies from Paddington to Avengers to Jungle Book. And little do I know, when I became a mother, I experienced tremendous birth trauma, breastfeeding challenges, and very severe postnatal depression. And 2 a.m. in the morning, when I was struggling in pain, feel very vulnerable and desperate, and when the baby is screaming the loudest, I couldn't find any support available. I have no access to healthcare professionals. I couldn't find anything effective and credible to support me as kind of digital solutions as well. So I told myself now that this is now my problem. I'm going to solve this for all the moms out there. So that's how I started to develop this solution. As a computer scientist, it's easy for me to actually prototype something quite quickly. So I worked with a number of IBCLC lactation consultants and a team of Hollywood industry colleagues. They know how to create visual effects, and we have someone who knows about boobs and breastfeeding. So we worked together to create 3D avatars to actually demonstrate how to position the baby on the breast in different breastfeeding positions, in different camera angles, even with anatomical views, so you can see through the baby's cheek and understand how the suckling works, because that's the fundamentals of a great breastfeeding experience. If you can have a deep latch, you will not quite easily crack your own nipple. Baby gets more milk, mom feel less pain, win-win situation. And it will save NHS a lot of money as well from A&E visits, complications mentally and physically. So that is a starting point. I'm going to cut this short very quickly because otherwise it's going to be a long story. So what I find really helpful was to find that support from back then AHSN at very early stage of my innovation journey. West of England AHSN, now Health Innovation Network, is my homeland. Basically, it's the birthplace of Anya innovation. So I got connected with the Health Innovation Network. I went to the HIP training with my little baby Anya. She was only like 4 months old. She graduated with like a hipster little baby girl as well. And I learned the business plan. I learned business model canvas and everything like that. And then keep developing the app. Won 3 Innovate UK grants, including the Women Innovation Award in 2021. And then we started to get help from West of England, HING again, to line up the pilot with 4 ICS. Back then, for a new innovator, product is still early stage, it's almost incredible for us. Then we got help to design the logic model, design the implementation framework, and then design how the questionnaire looks like at different checkpoints when you had a baby at 6 weeks old, 12 weeks old, and 6 months old, to capture how a digital health solution can help improving breastfeeding initiation and continuation. And a lot of stories also about how to talk to commissioners, understand the KPIs, and what makes them commission something before you start the pilot, and build that into your logic model. And eventually, it's not something about, at the end of the pilot, tell them buy our product. It's about monthly reporting. It's about infographic analytics, proving you are bringing value to them. You are hitting all the KPIs, you are changing lives in that area, and tell them at the end of 6 months that we are going to go now if you don't commission this, because we don't have funding to continuously doing this pilot. And for the best benefit of families, please consider commissioning us. And we actually converted 2 out of 4 ICS pilot partners into paying customers at the end of it. So that's my early journey of starting Anya.
Fantastic. Thank you, Chen. And it's a great story. Just that sort of transition to move from film and it's really bold. And I just wondered, one of the topics that we were talking about before was how you can repeat and have the same experience, in the 73rd sort of contract or project that you have to adopt your innovation, which feels the same as the first. And in terms of the spread that you have achieved, in terms of some of the challenges that you've had around securing those contracts from different parts of the NHS, what's your experience been, and has there been acceptance of some of the early real-world validation that you had of your innovation, or have you had challenge to need to go back and do things differently? How has that felt in terms of that point that Hassan was making about the train tracks? I wondered if you'd say something about that.
Thank you. So I know Hassan quite well. Hello. So I'm an NHS Innovation Accelerator Fellow as well, and Hassan has done a brilliant talk over there. We all love you so much. Thank you for being here today. So I would say it's extremely challenging to get your product adopted nationwide. You have to start everywhere from scratch pretty much. But what I've learned, I think a couple of things are very important. The first thing and the most important thing is evidence. It's your data and your evidence. I think from the very start of your innovation journey, you need to understand what's the pain and needs of your customers from system level, how you are solving their problems, and from day one, you need to start collecting evidence. And at the beginning, when you don't have money, you can probably collecting evidence yourself. Later on, when you have more money, you find a collaborator. For example, we are working with Unity Insight, which is an independent health economic agency. They are helping us to build that budget impact model and cost-benefit model at Greater Manchester, where we are running a large-scale pilot funded by NHS England. So first thing first, data and evidence, because if you gather more and more data, you can show NHS that it's a no-brainer to adopt your solution, because the money they paid for a particular innovation is incomparable to the money they lost from the preventable issues, and also we can help them to reduce workforce pressure so much so that NHS can perform better. I think the second thing I find very important is to listen to your users and listen to your customers always. So that co-design is not just a gospel. That's something you just have to do all the time. I love that book, Mom's Test, Hassan just mentioned. If you ask your mom about something, she will always say it's great. But if you ask your users and frame the question properly, they will tell you what kind of problems they have and how to make your product better, especially in the space of health equity challenges. We can't design a product only solving problems of people in a very narrow spectrum of population. We need to help to reach the hard-to-reach population, people who are from most deprived areas, people who are ethnic minority, people who typically don't even want to reach out to their healthcare professionals. So talk to them, understand what's their problem, design your product to solve their problems, and test with them, continuously improve. If you have a great product that patients like and healthcare professionals want to adopt, eventually everything will happen.
Yeah. Great, thank you. And so to pick up then, Peter, I'm going to bring you in now, if that's okay. So one of the things I certainly took away from Hassan's presentation this morning was that point about the market. And you can have that great product and a great team, but it's the market and how you access that. So these are quite big questions in the context of health and social care, and the detail that sits underneath the answers to the questions that Hassan, I think, was asking. But I wonder, from your perspective as a digital transformation lead within Gloucestershire, what would your perspective be on how we can support innovators to develop their products more easily and more fluidly access the NHS market? Any thoughts from you?
I guess, firstly, I'd agree entirely with Chen. The two key things are to have a product which is really meeting a user need. I think we see lots of innovations come where it may meet a very specific need. Someone's found a really good idea, but it's making sure that actually meets the system and the kind of health service need as well. And I know of innovations which haven't quite been able to do that and have therefore struggled to come to market because the market just isn't there. talk to lots of people. I mean, the HIN is a great resource as well here for that. And do that really early. Don't spend lots of time in development of something which you think is a good idea without really testing it with the service that you're trying to adopt it in. You know, that's the kind of key in our product, I guess. We might talk about this a little bit later, but there is definitely risk aversion in healthcare. I don't think we can kind of dress that up. There's lots of very good reasons for that, but that makes it a more difficult space for innovation. We do have a kind of regulatory environment as well, which also varies from organisation to organisation, which makes life really, really difficult for innovators, and I really appreciate that. And then we get to some of the challenges around sort of just the capacity of the system to be able to be amenable to innovation when the system is kind of running itself to the ground to just deliver business as usual. And I don't think there are any sort of magic solutions to that, but I'm gonna have to entirely agree with Chen. Like, a good product and use your networks and use people to find the right ways into a market. And if you have a good product, the market is there, partly because if you have a good product, that product will be well designed for a market which you've identified, because there is lots of areas in healthcare where we are not meeting need in ways that we'd want to. And those two things will help. And then there is a load of practical stuff which people like HIN and others can support with in terms of going from that initial approach to actually through a commissioning cycle, all that kind of stuff. So I've written myself some notes so I don't miss anything. But I think that covers many of those.
Fantastic. And just to say, as we go through this session, if there are comments that colleagues from the audience want to make, because we're a relatively small group, don't necessarily wait for Slido. Do stick your hand up, and we can open this out a bit. Jen, I just wondered from you picked up, Peter, on risk aversion, and I think from a HIN perspective, in terms of some of the work that you do around real world evaluation, I wondered if you might want to elaborate on that and say something more about, dare I say it, IG, that's often becomes a barrier, I think. And there are, future solutions to some of that, not least the secure data environment, for example, potentially. Looking at Nina Cross in the audience for a moment. But Jen, I just wondered if you wanted to offer any thoughts either on that or to build on anything that Peter was describing.
Yeah, I started grinning there because I knew that Pete was going to talk to me about some of those, kind of raise those risks and information governance procedures that we all have to comply with. Yeah, so absolutely. As somebody who's come from a research background for over the last 20 years or so, working within information governance and now GDPR guidance is something that's very core to what we do. I think really when we're working for our projects and when we're working with innovators, we encourage people to liaise with colleagues who have that kind of expert knowledge really early on in the process. So don't be afraid of it, lean into it a little bit. Find an information governance specialist in a site where you're working, or a colleague perhaps who's got a research background who can really help you to structure your thinking about how you might want to evaluate in that particular team and service, and any kind of pitfalls that you might need to look out for. Because actually, my experience of working with IG colleagues, they're incredibly detailed, but they're incredibly knowledgeable. So they are there to help you. They're not there to stop you. They just don't want you to kind of not comply with the law or any guidance, which is obviously really important. So they're really knowledgeable people, and we try to bring them into our process really early on. So when we're doing our stakeholder mapping, who are we going to be working with? They're one of the colleagues that we identify that we need to work with. And then we sit very carefully and we work out the detail of what we want to do. Because again, my experience is if you can go to them with a really well thought out plan, that assures them. And if you can give them an assurance that you're working safely and you're practicing in terms of research and evaluation and understanding all of the kind of guidance that you should, that reassures them. It's, sort of typically people who do work don't take into account that sort of guidance and then bring it to them and say, can you help me problem solve what I need to do to be able to share this work? So very much an important part of your project. Bringing them in early, I think, is important. And actually, most things are possible. And I think that what Pete was referencing in terms of new developments around secure data environments are going to be the next generation of way in which we access large sets of data in anonymized formats. And that really will be interesting to see how that expands the way in which we can access data across healthcare systems.
Fab, Jen, thank you. Chen, I just wondered if we could talk about procurement for a moment. So this wasn't in the scripted questions that I said that I'd ask you. But I just wondered, so apologies in advance for that, but I just wondered if you'd say something about your experience of procurement as you have, sought to work with, more and more ICBs and what that's felt like, how you've navigated it in a bit more detail. Would you share a little bit of that, please?
Sure. So my experience with procurement is that you've got to find something that works for you. Actually, we have between 17 to 21 contracts now nationwide, covering 7 million UK population. So that's actually 1 out of 6 birthing families in England can access Anya free of charge because of public health kind of commissioning. But we actually don't have many ICS clients. We sell to mostly local authorities. We just found that actually work for us because the government has funding for Note 19 services, and local authorities actually need to take care of the babies after they left the hospital. But actually, one more thing I want to mention is system-wide approach is really great because maternity care is a continuous process. And parents travel around different places. When they just found out they're pregnant, they go to the primary care. They go to see their GP, they have their booking appointment, and then they see their midwives. And then they go to hospital perhaps and birthing center to have a baby, and that become primary care somehow. And then they leave hospital, they have their midwives. After 6 weeks, they are 2 weeks, I think now, they are discharged to their house visitors. Actually, it's very important to understand where you sell your product to. At the very beginning, we're trying to sell our product to hospitals because it feels like a no-brainer. That's where babies were born. But actually, the value proposition doesn't quite match because yes, parents go to hospital to do their scans and give birth to the baby. But long-term wise, that value proposition probably much better with local authorities, with local maternity neonatal systems. It's about longer-term antenatal, but also until the baby actually is 2 years old. It's a long period of time. We actually expanded our solution initially from breastfeeding, then to pregnancy plus 3 months, and now to the first 1,001 days. And we kind of tested and learned that this actually resonates better with local authorities, covering longer period of time, and most importantly, this provides that continuity of care. I know this is an NHS buzzword, but really well here. Because a parent could probably met, before you actually had your baby and after, you might have 4 or 5 different healthcare professionals looking after you. You might have 3 different midwives, and none of them quite remember your history, your needs, and so on and so forth. And how to have a unified digital health solution that actually help you from this whole journey, from the beginning when you found out you're pregnant, until your baby is 2 years old, for all these roller coaster journeys, 24/7, you can get that support from a digital health product through AI, through healthcare professionals behind the scenes, through local signposting, and AI can actually remember your challenges and needs and know all your histories and know all your heartbreaks, know all your anxieties, know your emotional and physical needs and support you around the clock. That is what we try to achieve. And that it has very great impact already we can see across all the 7 million population we are serving right now. We are solving problems now for the local maternity neonatal system, for the local authorities, and for the hospitals. So I would say find out who you're actually selling to. For us, we're not selling to primary care. We're not selling to secondary care. We are selling mostly to local authorities, and hopefully we can sell to the ICS. But my personal experience is selling to ICS need rock solid evidence base. Rock solid evidence base. You need a proper real world evaluation if possible. Health economic study, budget impact model need to be built by an independent evaluator, properly build all your logic models and KPIs into that, and the procurement process can be quite long, but selling to local authorities, we sometimes have a contract signed within 4 weeks, because there is a real needs over there, and they can really see the cost efficiency of having Anya to support their local families. One last thing I want to mention is you've got to find a business model that works for you as well. So when we initially had our pilot with the 4 ICS, we were using a token-based model. Means we give a ICS 500 licenses, and when they run out, they come to us for more. And it's just according to what Hassan was mentioning earlier, it's not adoptable. It's not so easy to be adopted. You need something simple and easy to be signposted. So then we use a population health model now. So how it works is if we are adopting in Gloucestershire, anyone can download Anya from App Store. Anyone can use a Gloucestershire postcode during the sign up to upgrade to a premium version. Then anyone, mom, dads, uncles, family members, whoever live in Gloucestershire can access Anya free of charge. That is a population health model. That helps people from the most deprived areas. There's no prioritization of who should have this solution, who shouldn't have this solution. Everyone should have this solution to help to outcome, and this is actually the best way we find as a good business model to support populations and health systems.
Yeah, fantastic. Thank you. So you've really adapted to that model to develop. Peter, I saw you nodding. I just wonder from a procurement perspective, is there anything you'd add to this discussion?
Can I just add a little IG thing there? And I think Chen is really, the point he makes about all the information that you're putting in to make the product good, the really, really personal stuff from Anya about your, that's the reason we have IG, because actually as a health system or as a public sector body, we have to protect that information if you're putting into a technology that we're providing for you. So I think IG sometimes gets a really bad name in terms of being a big blocker. Actually, there are people who are trying to help and support products and services go live, but we do have a really important duty around confidentiality and privacy, and maintaining best access to data.
Thank you.
I guess to talk about, we talked about procurement was the first bit. I think it can be a real challenge. I think certainly, especially as we're seeing a more and more constrained kind of financial picture for the health service, the requirement for evidence is probably only going to increase. So I think your point about,
Do you mind if Deb just comes in first? Yeah. That might should work.
It was just a question about, talking about selling to. Obviously in the NHS and in the ICBs we've got a public legal statutory duty to make sure that we're supporting competition, we go out to the open market, we ensure that there is equity of opportunity for various different innovators. So our opportunity to find a great product and then just go and buy it is really limited. I'm just interested to understand how the panel feel that we can actually start to be more effective in that space, but still meet our statutory responsibilities that are enshrined, not just because we've made the rules, but in the law.
So I think there's really something about where we are on the innovation journey, and how do we look at partnering at innovators at a very early stage. How do we support evidence generation? So that's not being unequitable, that is actually supporting evidence and research right at the early stages of innovation. And how do we kind of leverage the kind of populations that we have and the kind of resources that we have to do some of that early stage work, which means that innovators can generate the evidence they can to compete in that equitable plane when we're looking at that kind of procurement side, and being really clear that it's part of a journey for me. So I guess it's being clear about which part of the journey as an innovator you're looking to kind of get into. Are you looking to sell directly? Are you looking to generate evidence for your product? Or are you looking to do something more real world? And all of those areas kind of which span both the research and contracting space will have a different structure, but can support each other along the journey.
Yeah, thank you. Chen, I'm going to ask you, what your thoughts are on that question as well. So from an innovator perspective, there's that challenge there. Sorry, in terms of that balance of responsibility. How would you answer that?
So for Anya, data security and clinical standards is very important. We have that responsibility, like Peter just mentioned, the IG is very important, and patients' data very important. So we have certain standards to meet. For example, we are DTAC compliant, and that's a high NHS standard. And we also we are on different procurement platforms. For example, G-Cloud 14 or LLP, buzzwords everywhere. Anyway, we need to be on those platforms to prove we are good enough for procurement as well and maintain that standard. Another thing I find, and this is a procurement addition I want to mention, is that client success is key, right? When we sell to a local authority or ICS, it's not like, here's our solution now, everybody can use it, good luck, bye. It's not that. You need to have a client success manager for that area, and you need to help them to increase the take-up rate, making sure the families actually hear about your solution, they actually use your solution. Your solution needs to be embedded into the clinical care pathway. So what Anya is trying to do is that when we start selling our product to an area, then we meet the key stakeholders, and then we understand from antenatal until the baby is 2 years old, what's the care pathway? How can Anya be embedded into every step of the way? From the pregnancy until scans, until hospital, until going back home. How can we embed? How can we make healthcare professionals signpost Anya more easily? We get Anya's QR code on their lanyards. We give them healthcare professionals free version of Anya in their own version. So it helps them with CBD training, but also they can show people Anya on the hospital bed, so people know how to actually download Anya and use Anya effectively. And we also have monthly reporting meeting with them. We show them the analytics and dashboard. They can create their own dashboard, and they go there, they can see in my area who are using Anya, what kind of question they are asking, what are the trendy concerns from people, how can we support them as the NHS better to our patients. And then if you're consistently helping them to make sure the enrollment is good, engagement is good, and then track your health outcome to show that, because Anya can demonstrate that people reduce their anxieties before they have a birth, they have better birth experience, they have doubled breastfeeding rate compared to national average, they have less chance of developing postnatal depression because they feel more in control, they have more options. Those things really shows, the data shows the big volume. Your customers are happy, they tell other customers. So more than half of our customers are from referrals. They tell other NHS clients, NHS colleagues, local authority colleagues about, this is a great solution, you should adopt it. That's far better than you knock on the door begging people for a meeting and tell them how great you are. Even with great data, it's better to get that referral.
Thank you, Chen. I'm conscious, Nina, I'll bring you in. I'm going to ignore Slido, if that's allowed, because we're going to run out of time. So Nina, would you like to come in?
Hi, my name is Nina Cross. I've just started working with the Health Innovation Network to support this secure data environment that people have been mentioning. But actually my question is for you, Peter. Early on in the presentation, you spoke about how it's really important for innovators to understand the system and the health service needs. How can they do that? How do they do that at the moment? And is there ways to improve how that knowledge is shared with innovators?
I mean, certainly there are ways to improve that. I think we've got a way to go to be really clear about what people might call demand signalling. So there's been an interesting national consultation around medtech, which is about one of the key elements of that is around demand signalling for innovators. So what are the products that the health system is going to be worried about, and therefore how do we bring innovators in to solve those very specific problems? I think many innovators are either a clinician, there are many clinical innovators. So to those people, I would suggest one of the kind of questions for you is how relevant is this sort of outside your immediate clinical sphere? So making sure that you've looked at other perspectives from the health system. And then I think there is something about organisations like the HIN and others who are that kind of trusted intermediary between innovators and the health and social care systems. They have good context, they have good knowledge, as well as kind of approaching people locally as well. Like certainly we're very supportive of people coming to us and asking about that, but I guess it's not always an easy sell, and we also may tell you something that you don't want to know. We'll probably be quite nice about it, but there are definitely some products that don't actually meet a clear need that organisations or systems have, and that's a really difficult message if that's a product that you've spent time and effort and energy and money and all that to try and deliver.
Thank you. I think from a HIN perspective, I think we recognise in the context of our strategy that we need to do more to engage communities and really understand their needs. So it's a big focus, I think, to link in with partners to do that too. So I did just want to mention that. We are running out of time, and I've been told we've only got a couple of minutes left. So I'm going to do a late Max Mosley on you and ask if there was just one thing in terms of how we could more effectively partner with innovators to help them accelerate their proof of value and better access the market. What would that one thing be? So Jen, I'll start with you, if that's okay.
I think coming from the perspective of real-world evaluation and evidence generation, I think it would have to be to plan ahead and build that into your innovation journey so that you're able to demonstrate that evidence at every step and have a really clear pathway to evidence generation. I mean, I think from an evaluation perspective, evaluation falls into formative and summative, so you do it during the process or at the end. But actually, even if you think you're going to generate evidence at the end, you still need to plan for that. You can't wait until you get to the end and then hope that you'll have that evidence in place. So I think having a really good plan structure is only going to help you in terms of when you get to that point of working with an ICB, trying to be able to find that market, you've got that evidence there that helps to demonstrate the need.
Thank you.
I think sometimes from an innovator's perspective, it can feel quite challenging to come and work with a health service. I think innovators will take that, and Hassan and Chen have pointed that earlier. I think come in with your eyes open, come in with a knowledge that there will be regulations, there will be issues. We just aren't, we're not the tech sector, we're not retail, we've got real reasons for some of the challenges and regulations that we have, but come and engage, and we want to support you on that journey, and we want to work with innovators because that is fundamentally the way that we adapt and develop new ideas, technologies, innovations, and systems as well. We tend to talk a little bit about innovations as kind of point solutions. Innovations can also be the way that we manage and develop our system.
Thank you, Peter. And Chen.
Thank you. It's hard to say just one thing. I would say three very small things. So firstly, I really think there should be a playbook for entrepreneurs like myself, digital health innovators or health tech innovators, because I want to write a book, a small book hopefully, about my heartbreaks, my roller coaster journey as an entrepreneur in health tech and in NHS, because there's so many mistakes I made people don't have to make. They can just learn from many people's collective experience, so it will shortcut the process a lot easier. It doesn't mean the pain is less, but at least you know what you are up against and how to make that more efficient. I think the second thing is I think you absolutely need more support network. HIN, great. We are having another real-world evaluation paid by Gloucestershire. Paid by West of England HIN at Gloucestershire. I'm really grateful for, but I'm the lucky one. There are more people who haven't got all this support. they might need to reach out more to HINS to get support, and I think HINS probably can find more of them to support. Support is so important because a lot of innovation can die at infancy without even going anywhere, but there are so many great ideas and entrepreneurs like myself who need support. The last thing is my daydream, so you don't need to take it seriously. I really think NHS has a national adoption mechanism or some kind of a uniform infrastructure so that when you win one place, you can win in other places. Or when you win in one place, other people know how great you are, so they can just adopt you rather than you have to start that journey everywhere from the beginning. That makes it very hard to scale, and that makes innovators go to the US or elsewhere to spread.
Fantastic, thank you. And it's good to dream big, of course, absolutely. So I think we've run out of time. Thank you for the questions. Thank you to each member of the panel. And I think that's lunch.